Singapore Nursing Board, SNB, exam pattern. Nurses or midwives who are foreign trained are required to sit for the SNB licensure exam and acquire an SNB license in order to complete applications for enrolment or registration with SNB and be qualified to practice in Singapore. Singapore Nursing Board Registered Nurse Licensure Examination, SNB is a standard test for Diploma BSc nurse who are qualified in overseas to enter profession in Singapore. After successful completion of this test, nurses will get registration with Singapore Nursing Council and become eligible to work in Singapore. The SNB is a theory-based test which consists of multiple choice questions. To attend SNB nurses should have minimum 2 years post-registration experience. SNB is a test based on nursing theory which assesses skills in nursing on professional contest. SNB exam pattern. Singapore Nursing Board conduct exam for enrolled nurse, registered nurse and registered midwife. Generally, SNB is a theory-based test which consists of multiple choice questions. The duration of the examination is 1 hour. The examination is a 1-hour paper. MCQ questions. Theory-based test. Sample enrolled nurse licensure examination questions. Which of the following would be an appropriate health education for a client with peptic ulcer? A. Adhere to a liquid diet. B. Drink coffee instead of tea. C. Take small but frequent meals. D. Drink some alcohol every night. Answer: C. Take small but frequent meals. An elderly client is allowed to ambulate to the toilet. Which action is not important for the nurse to take before leaving the elderly client's bedside? A. Wash hands. B. Lower the bed. C. Assess the pain. D. Toilet the patient. Answer: B. Lower the bed. Sample registered midwife, RMW, licensure examination questions. What would a client with hyperemesis gravidarum be at risk of? A. Metabolic acidosis with dehydration. B. Metabolic alkalosis with dehydration. C. Respiratory acidosis with dehydration. D. Respiratory alkalosis with dehydration. Answer: A. Metabolic acidosis with dehydration. Following delivery, what would be the midwife's immediate goal for a newborn? A. Prevent respiratory distress syndrome. B. Clear the airway and establish respiration in 2 minutes. C. Ensure that the umbilical cord is clipped tight and secured. D. Obtain the oxygen concentration in the circulating blood volume. Answer: B. Clear the airway and establish respiration in 2 minutes. Sample registered nurse, RN, licensure examination questions. Post-tracheostomy, the nurse will check for surgical emphysema by A. Monitoring the amount of aspirates. B. Monitoring the rate of respiration closely. C. Palpating the skin area around the stoma. D. Assessing the stoma dressing for hemorrhage. Answer: C. Palpating the skin area around the stoma. Ma'am Rena is diagnosed with advanced lung cancer. She has lost 12 kilograms since her diagnosis. As a nurse, you would A. Administer intravenous hydration. B. Administer oral nutritional supplement. C. Consult a nutritionist. D. Consult your nurse manager. Answer: B. Administer oral nutritional supplement. Thanks for watching this video. Any questions, comment below. Thank you.